An honor to be here, and just love coming back to DC and experiencing family and friends. Grew up in this area, went to St. Albans School, and also had a great experience working here. My first job right out of residency was at Upper Cardozo over at 14th and Irving, and worked a number of years in Baltimore as well. Followed in the footsteps of Dr. Michael Barr, your chief medical officer. So I've got a starting question here. What is this? What is that? Let's go back 200 years. The first stethoscope. So it's about 200 years ago, and I've been fortunate enough in my role at IBM to get a view across the globe of many different places, including going to France and seeing some of those original stethoscopes that were created by Dr. René Laennec. And what I want to highlight here is that in many ways, what we're trying to believe and create here as it relates to Watson is around a big data stethoscope. And as I reflect on those first years, coming to DC right out of residency after taking kind of my boards and residency in internal medicine and pediatrics, looking as a National Health Service Corps scholar to serve underserved communities, looking at the broader social determinants of health, recognizing that in so many ways I was really unprepared to handle the challenges of delivering care in those settings. As you think about the amount of time you have, and time being that precious commodity that we all have to give to each other. And I realize you're giving me 15 minutes right now, and I can see it right here. I also realize that in many ways, the amount of information that doctors have, and those charts that were paper-based initially, and remember getting them rolled in the morning, and having 20 to 30 patients originally scheduled and eventually 40 patients scheduled, and having those 4 or 5 charts missing, and having that opportunity to scan through that chart and sometimes not be able to read the other doctors before me or the other specialists or the other key team members, but looking at that data, looking at that information in a medical record, and then having those journals, that pediatric journal, Annals of Internal Medicine, having JAMA, having Lancet, feeling smart about subscribing to all these journals, New England Journal of Medicine, having on my shelf with no windows at Upper Cardozo. And then those textbooks, Nelson's and Harrison's, and feeling in many ways incomplete, feeling in many ways that I couldn't know everything there was to take care of those patients in those 15 minutes. Recognizing in so many ways that those patients I took care of had so many other determinants of health that I wasn't prepared for. The broader social determinants of health, those cross-cultural challenges, linguistic challenges, limited English proficiency, leveraging language line, and the broader team members. So as I think about this, it's a big data challenge. And as I think about the past 200 years and how in many ways technology now has played a role with EMRs, in some ways not really to help sometimes with that relationship as much as we thought it would, how can AI support that engagement? How can AI support those relationships that are fundamental and foundational to why I and many of you became healthcare professionals and have passion for this work? So as I reflect on this, I go from 200 years to 100 years ago and how IBM was started. Imagine a company being called International Business Machines over 100 years ago. Think about how relevant that is today. I, in my role at IBM for 6.5 years, have flown nearly 1 million miles across the globe. I've been all over Asia, I've been in the Middle East and Africa, I've been in Latin America, I've been all over the US. And what I've seen is how important health and healthcare is, how similar it is across different countries, different cultures, but how much commonality and how much differences we have in terms of how we value it, but how much commonality we have in how we address it. So as we think about technology to help that relationship between a doctor and a patient, you have to think about these different eras of computing. And we are in the AI era. We were in eras where tabulating was important, programming is important, and if you look at your cell phones and your computers, those are all systems that are programmed. What we're talking about is a system that understands, reasons, learns, and empowers. Think Star Trek computer. The role of that computer to help Spock, Dr. McCoy, or Captain Kirk, to help them make better decisions. So in this era, what I want to highlight here on this simple slide, although it's got a lot of numbers on it, very data-driven, is to think about how we can leverage that data, how we can address that big data challenge, how we can think about the different silos of data that exist. There's clinical data, there's EMR data, there's claims data. There's also social data. There's so much broad social determinants of health data. I love the county health rankings and how it aggregates different types of data. I mean, when we were looking for a home as I moved to Needham, Massachusetts, I was looking at Zillow. I was thinking about education in schools. Why is it not as common to think about living in a healthy community? Looking at ways to personalize those interactions, those choices, so that if I'm at higher risk of diabetes or heart disease or some other risks based on a broader profile, that maybe I should choose a community that's better suited for me. And health should be just as important as education. This idea of environmental factors. If you think about weather, and one of the things that IBM acquired was the weather company. Think about the impact of weather as it relates to asthma and COPD and skin cancer. But think about it as it relates to healthcare utilization. Think about how it relates to other factors of health and behaviors that play an important role in health and health outcomes. Then the wearable data and this instrumentation that's occurring across the globe, this movement where we're frankly comfortable sharing our data as long as we get value. And that gets me the 5 V's of big data. Something I learned because frankly, I'm not a health informaticist. I'm not a technology expert. Coming to IBM 7 years ago nearly was serendipity. To be able to be exposed to people who understand data in a way that I could have never learned. To have those data scientists, those cognitive specialists, those AI specialists who can look at data in ways and bring insights out of it from those 5 V's of big data. The volume of data is growing at extraordinary pace. Each of us will produce 300 million books worth of data in our lifetime. The variety of data that I just highlighted is significant. And there's such opportunity to leverage all those different types of data sets with the appropriate thinking, consents, and connectedness with a patient, with a population, with an institution. There's opportunities to bring those different data sets together, to break those silos and apply AI, machine learning, and cognitive technologies to bring insights from that data, to bring what we really need in the healthcare system, which is value. So you've got to think about that velocity of that data, not only healthcare data, but health data. There's hundreds of health decisions we make every day as it relates to physical, mental, social, purpose. There's so much opportunity for us to leverage those other types of data as we connect it to healthcare data. There's also the veracity of that data. As we've discovered, as we look at different data sets, a lot of the stuff in medical records or claims data or other data sets has problems with it. You could have in the same medical record 2 different diagnoses that are completely opposite or different. So we've got to address the veracity of that data as well. So thinking about those 5 V's, thinking about the stakeholders that you need to bring those insights to, what I like to call the 7 P's. So ultimately it's for patients. And it's crazy that we have a system, if you think about it, you reflect on it. Different industries, especially at IBM, you get to see how we impact other industries like banking, financial, retail. And you think about how we have an industry in healthcare where we call them patients. Be patient. We have waiting rooms. There is a transformation that needs to occur as we think about patient-centeredness, empowerment, and there's opportunities to bring those insights to those different stakeholders, health plans, payers, employers, purchasers, providers, the whole healthcare team, not just physicians, mid-levels, nurses, pharmacists. We have to think also about policymakers, government. The role of government is such an essential role that we have to determine. And prior to coming to IBM, I like to say I went from big red to big blue, and how exciting that was to be a policymaker at HHS at a time when there's so much need for transformation in health and healthcare. Product manufacturers, pharma, medical device companies, and then the pioneers, like all of you here today. So as we think about how AI can impact, I want to highlight just a few pieces. Going back to that physician-provider relationship, the fact that 25% of the time that doctors typically spend is actually talking to patients or listening. The fact that the average physician spends, in a family physician study that recently came out, 86 minutes a night on the EMR, doing their documentation. Thinking about how you can have a system with those textbooks, those journals, that can read those medical records, structured and unstructured data, that can understand it, that can reason with it, that can continue to learn and improve, that can ultimately do what I stated earlier, empower those individuals, those healthcare providers, those payers, those policymakers, those product manufacturers, to get valuable insights out of those 4 other V's of big data. Ultimately, those insights that help you make better decisions. And what we call augmented intelligence, what we call actionable insights. Big data on its own is not sufficient. It's great now we have these stores of data that could be potentially read and supported. It's humanly impossible for any doctor or any provider or any healthcare person to know all that information, to keep up to date with the 8,000 publications that come out every day. But to have a system that can support you with natural language processing, with this idea of locating knowledge and patterns to address issues of endless capacity and complement it with people who focus on those relationships and do what they do best is ultimately what this effort, and what I believe, think about the internet in 1993 and what it is now. That's 25 years ago. I believe in the next 25 years, next 200 years, we will find, actually sooner than that, every health decision we make, whether you're any of those 7 Ps, a patient, a provider, or others, will be made with an AI system supporting it to deliver that augmented intelligence, that actionable insights. So in the last 5 minutes, I'm going to reference just some ideas as we go on this journey together. Watson Health at IBM is only 2 years old, so I like to call it our terrific 2s as opposed to terrible 2s. We are at the beginning of a journey of translating that big data into key insights for those 7 Ps, to translate the 4 Vs of big data into the 5th V of value. And as you think about different settings, I reflect once again as a primary care physician, I would only have maybe 1 hour out of 8,760 hours a year with that patient, one-on-one. How wonderful that was, but how challenging it was to leverage health, social determinants, cross-cultural challenges, access issues, health literacy in only that 1 hour. How can we find ways to potentially leverage AI to create maybe a digital scribe? So that instead of me having to spend time like this, I could see a note, see the order, see it all presented to me in a way that's transparent, and I could make a decision that's it. Now I can spend more time with the patient. All right? Or accreditations. The process of accreditations, in many ways, whether it's specialty accreditations or NCQA, maybe there should be an automated way to connect to the data continuously. So it's not something you have to do annually, it's continuous. If you can read structured and unstructured data, and you can see a facility is delivering great outcomes, then perhaps that's a way you can leverage AI to have continuous accreditations, continuous recertifications for providers. If you think about now going out of that clinic to the home, think about ways in which you can leverage. We just bought a security system for our new home. Especially as I think about my parents who live here and are elderly and challenged with a lot of the challenges of aging, and we're challenged from a caregiver perspective, and we're balancing so many other choices as a family. This idea of maybe having the home instrumented in a way to promote a healthy home, to think about ways in which we could potentially try to keep people at home, which is where my parents want to be, but looking at ways in which devices in the home, instrumentation in the home, could potentially better predict, better personalize, and better prevent frailty issues. I also believe in a future where there will be device and app formularies. In the same way that a physician prescribes drugs, or a test, or an imaging test, or seeing another doctor, there will be a future where you'll have an app formulary based on value-based care, based on performance, and that will be a tool that will be used to help prevent diabetes or treat diabetes. And there will be ways in which that app formulary will play a role in promoting better health outside of that exam room. This is the last piece in terms of community. As we think about data privacy and security, as we think about the generation that we have, where to me privacy and security is nothing's more important than that. Trust is based on that. You know, when a doctor treats a patient, that's trust. That data is in a medical record. That's trust. But if you think about the opportunity with data, I want us to add data philanthropy, data donation, in the same way that I can go to the DMV as you think about that choice to be an organ donor when you die. Think about the potential of leveraging data when you're alive, that you could donate your data in a de-identified, secure, private way to help different stakeholders in health and healthcare find new discoveries, find new ways to better deliver, to better predict, to better personalize and prevent bad health outcomes. There's so many cases that I've seen where people are so excited about the potential and power of Watson and say, I want to give my data so that maybe you can find something to help someone else. So this idea of data privacy and philanthropy in communities. Last, I'm just going to highlight these 3 principles of AI, which is very important as we think about this new era, as we think about the potential, the promise, and the potential peril. We have to think about principles of AI. Purpose is to support humans, not replace them. Transparency is essential. This is not a black box. This is a glass box. We need to be transparent about how these systems are trained and the information that provides recommendations through these AI-supported systems. We also have to realize that a new world will emerge, new collar jobs, new skills, and there will be a new model with human plus AI to potentially deliver those better outcomes. On that note, I'm looking forward to this journey. Thank you very much.